Go ahead and start. So here we go, 21 questions, and here we go. First question. The breach notification rule requires covered entities to do which of the following? Okay. All right, so it looks like two people got it wrong and one person got it right. So the correct answer here was A and B. So the breach notification rule is going to, first off, notify affected individuals when a breach actually occurs. And then this rule also requires that there is some form of a process when it comes to the actual investigation of the rule. Okay, so the policy on minimum necessary was not the answer there. Okay, so if you're not sure about that, I promise you it's in your textbook, and make sure that you know that information about the breach notification rule. All right. So this is the scoreboard right now, and you are on top there. So let's go ahead and go to the next question. True or false? HIPAA grants individuals the rights to access the protected health information. And please read the question carefully. HIPAA grants individuals the right to access their PHI. True or false? About 5 seconds left for this one. 3, 2, 1. And all of you got it wrong. Tell me why you think you got it wrong. Or right, rather, it is right. Did you guys get it all right? Oh, yes, you guys all got it right. So what I did here was HIPAA was spelled incorrectly. HIPAA is HIPAA. So HIPPA is not right, because that is not the right acronym. So this is to test you guys on the importance of the details when it comes to studying for your exam, right? You want to make sure that you're paying attention, because one word can change the answer completely, right? So the correct answer here was false. HIPAA does grant it, but it's HIPAA. All right, good call out there. Let's go to our next question. And before we do that, you are still on top, and you guys are following right after. And the scores are based on how quickly you answer as well, so you guys know. All right, next question. Blank is a voluntary process of organizational review in organization evaluates the quality of the entity work. So this is a voluntary process where you're going to be evaluated for the quality of your work. Is that indexing, certification, accreditation, or implementation? 40 seconds. All right. And it looks like some got it wrong and some got it right, but the answer here was accreditation. So a certification is a required documentation that you have to have in order to work, right? To be a medical doctor, to even, work in certain jobs, you have to have your RHIA, versus accreditation, which is done by hospitals in order to get, higher praise or achievement in the community. So that's a accreditation. All right, let's see the scoreboard now. Oh, there's a change. All right, Jax, you are up on the leaderboard now, okay? Let's go ahead and go to our next question. True or false? This is an example of a negatively skewed histogram. True or false? You got about 20 seconds. Okay, about 5 seconds left. Let's give it a guess. All right, so it looks like one of you didn't answer, but the answer here is actually that was a negatively skewed histogram. How do you know if it's negative or positive? I like to think about it like a pet, right? Like you have your dog or your cat, and their tail is always supposed to be at the end, right? So I say that the tail is on the right end. So if you look back at that image, you would see that, it won't let me show you, but you'll see that the tail was in the front. So the dip was in the front, which means that it's negative versus being in the back. So if you see a dip in the front, it is a negatively skewed histogram. If it's dipped in the back, then it is a positive. Okay, so that was a negative. All right, let's go ahead and go to the next one. Okay, and it is anybody's game, as you guys can see. Let's go ahead and go to our next question. The release, transfer, provision of access to, or divulging in any manner or matter of information outside the entity holding the information is what? And you have about 45 seconds. All right. And you guys answered that quick. Disclosure. Good job. That was disclosure. Perfect. Right. Let's see how we're doing on the scoreboard. All right, Brenda, you are still on top for right now. Let's see how we go with the next one. And you are on a streak with 4 correct answers. Good job. Another question. Under the HIPAA, and it is spelled right, privacy rule, patients have a right to receive an accounting of disclosures for the past blank years. What's that blank? And this is according to HIPAA's privacy rule, not what's done at your facility. You got about, oh, you guys are quick. So the answer here was actually 6, and I got this directly from the textbook. So if you see this question, just know that the textbook answer is 6. It may be different, like I said, at facilities, the numbers seem to change sometimes. All right, but you guys will hopefully remember that next time. And yep, scoreboard is moving around. Let's go to the next question. The form of malware whose programs reproduce on their own and have no need for a host application, they're self-contained, is called what? What do you guys think? We got about 45 seconds left. All right, so we got all different answers, and the answer here is a worm. So worms are the ones that can reproduce on their own. A virus will actually need to have something to embed itself within. And then there are 2 other ones as well that I talk about a little bit in the course. One where you're able to hack without the person knowing. So what I would do for this is, once again, please be sure to just look these up and read them. And they should also be in your lectures as well. So make sure that you guys know these just in case they pop up. All right, let's see how the scoreboard looks. All right. Pretty close game. True or false, 30 seconds. A covered entity must train all members of its workplace on the policies and procedures according to HIPAA privacy rule. Is that true or false? Okay, you guys answered that fairly quickly. That is correct. So as HIM professionals, we have to know this, that if we are in charge of a department, we need to be sure that we train everybody on how to handle PHI. That is a rule under HIPAA privacy. So good job, everyone. All right. Game is still close. Here's another question. What does SQL stand for? Got 60 seconds. All right, good job. Everyone got that right. I wanted to trick you guys, but you guys got it. Structured query language. That is what SQL stands for. That is correct. All right. See if that changes the board at all. You guys are close. Here we go. True or false? Barcoding and optical character recognition helps us enter in healthcare data quicker, accurately, and automatically. True or false? Okay. That is correct. It does help. It helps a whole lot. So you guys will see the little barcodes in all aspects of healthcare, and it really helps make things work more fluently. Okay. You guys are neck to neck over here. You're making a comeback. Here we go. Next one. Which data visualization is closely related to the 80-20 rule? This should be in domain 5 if you've been, taking the course. Should be in my domain 5 lecture. What do you guys think? Okay, about 37 seconds. Still have time. All right, the correct answer was the Pareto table. Oh, so, yes, the Pareto table. So the idea is that, well, first off, the Pareto table is organized to show you the errors or the defects or issues in an organization from the biggest issue to the smallest issue. And so the 80-20 rule states that 80% of the issues that are happening are due to 20% of the problem. So it's kind of, once you fix one issue, it will affect and fix everything else. So everything kind of relates to each other, 80-20. So fix one fraction, and then it'll fix everything else. Okay, so that's the whole idea there. All right. All right, you're on a streak. Let's go to the next question. Blank. This is a definition. This is used to enhance communication amongst an organization's internal employees and facilities. It is internet technology used. What is the answer here? Still got 50 seconds to go. Good job. Intranet. That is correct. There's extranet and then there's intranet. So extranet will be for non-employees, right? For protection. Intranet will be for those in-house. And then if you guys have watched the lectures or have been studying, you've heard the term firewall, and that's there to prevent people outside the organization from coming in. So make sure that you know that for your RHIA. This actually was an answer choice from your exam prep book from AHIMA. All right, let's see if the score changed. All right, we're still in the same order here. Let's go. Identify the CPT code. Which one is a CPT code? 60 seconds. All right. So number one or V55.3, that's actually a ICD-10 code. The select was a SQL command. This was the answer because all CPT codes are made up of 5 numbers, numeric numbers. Then I put this one on here to kind of throw you off because there's 7 and the rule is that it should be 5. Okay, so that is why the answer here would be 54234. Okay, so make sure that you know the rules when it comes to CPTs, ICD-10s, and be able to recognize them as well as know the purpose of them. All right. Are you looking for a quality RHIA test prep course? Well, look no further. I want to present to you the RHIA Essential on-demand course. I have taught hundreds of students in person and online, and I am excited to be your instructor on your RHIA journey. As a student of this course, you're going to get access to over 8 hours of video content that contains notes, mnemonics, quizzes, and more. And yes, guys, I said video content. No PDFs to study from here. Look forward to 90 days of handcrafted content to assist you on earning your RHIA certification. In this course, you are going to learn health IT law, data governance, classifications and codes, database management and design, record retention, data visualization, levels of measurement, CDI, insurances, project management, and so much more. You get a user-friendly workbook and bonus RHIA content to prepare you for test day. It's the only course you need to become RHIA certified. With our premium package, we also offer our RHIA guarantee. Pass your RHIA exam or our tutorial service is free. Registration is open now. Get started at www.rhiaessential.com. See you soon. Let's check out the board. All right, guys are doing good. Next question, who maintains the ICD-10 CM codes? Which organization? This one's a tough one, but you have to know this, believe it or not. All right, good job, everyone. That is the correct answer. That is the correct answer. It is the National Center. Oh, sorry, it is the National Center for Health Stats. They are the ones that actually maintain the codes. But the ICD-10s are administered or are monitored or were created, right, by WHO, but they are maintained by NCHS. Okay, so these two work together in order to make sure that the codes are up to par, and the American Medical Association is going to focus more on the CPTs. So that was there to kind of throw you guys off. And HIPAA, you guys know that has nothing to do with any of this, right? So let's see how that has changed the game, if any. All right, next. The blank is a representative group of key stakeholders who provide advice and guidance in an acquisition. End users, Scrum team, PMO, or the steering committee. This is domain 5, project management. All right, and the correct answer was steering committee. PMO is actually going to be the office of people that are in charge of creating the policies and guidelines that project managers have to use when they're working. So they are like the governance when it comes to the project management department. Steering committees are going to be those that are going to be making decisions when it comes to a project. So that's the difference between the two. Scrum, definitely not it, right? And end users, those are your customers. So definitely study that, domain 5. All right, and Brenda has pushed you out the way. Let's see how we do here. We got about 5 questions left. So let's see who's gonna end this on top. The case mix index for this table is, and I'm gonna give you guys 4 minutes. So pull out your calculators and let's figure this out. 4 minutes. And there's already one answer. And you still have plenty of time, no worries. Have over 3 minutes to figure this out. So take your time. And you have just over 2 minutes left. And this will for sure be on your exam, for sure. One question would definitely be case mix. Okay, about 1:30 left. All right, got about a minute left, so please don't feel the need to rush. I want you guys to get the concept right here on how to add this up. All right, and that is the correct answer. And just to show you guys how this whole equation works, let me check the scoreboard first. Brenda, you are still up there, ma'am. This is actually directly from the video that is on YouTube. So if you haven't seen this before, please be sure that you do watch this, because it does show you the steps on how to solve this. And I just wanted to show you guys the very end of it, which would be the breakdown of everything right here. Let me pause it. Let's see. So I'm gonna put right here. So this is what you would have to do to get the right answer. So please practice this. You will see one question on this guaranteed, okay? Okay, let's move on to the next question. True or false? Metadata is data about data. Is that true or false? That you guys are quick. Yes, that is true. Happy you guys know that. Perfect. And some examples of data about data, even just the time that the doctor signed the patient note, for example, the medical chart is an example of metadata, data about data. Okay. All right. This type of healthcare reimbursement is based on a per person premium or membership fee. 60 seconds. Okay, little under 30 seconds left. This is from domain 4. All right, the answer was capitation. And let's see. So global payments is when a provider or a group of providers receive a lump sum of money that can be used to pay for a patient's care. Medicare, as you guys know, is just the insurance that is used for the elderly. And fee for service is when you get service. So if I want to get a surgery and they do a particular procedure for me, they'll assign a particular code based on what I'm getting done. So fee based on my service being done. And then this is more like the membership situation. So please watch the course or the video in your course about this. I talk about all of these. So with that, Jax has moved right on up. You guys are neck and neck here. Okay, blank. This is an actual definition. Leadership behaviors that emphasize moral and ethical orientations to how the organization and employees should function. This is domain 5, project management. It's a tricky one. What do you think?
I'm not able to answer because my screen froze up. So I might skip that one.
Okay.
Like I'm watching you on my iPad, but I'm doing the questions on my phone.
Oh, okay. Gotcha.
Okay, it reconnected.
Oh, you're good. You're good. You're good. You can like you're still in it. You're still in it.
I just do an answer through.
Okay. So the correct answer here was value-based leadership. Okay, moral, ethical orientation, value-based leadership. This is the opposite of that. This is the controlling individual. So you don't want that kind of leader. And then this is just like a random term. And then this is the theory that you treat people differently based on who they are. So you may treat one child one way versus another child that you have, because maybe one is more sensitive or one is more emotional than another. So it's situational leadership. Okay, but the answer here should be C. Domain 5. All right. And I think we have one more question, and then our Kahoot experience is coming to an end. So here is the last question. Late majority groups usually adopt innovation only after social or financial pressure to do so. And you can just, that should be a blank. So actually, the answer is kind of in your face, to be honest, but feel free. Free point. Free point. Yeah, so it is late majority. So that should have been a blank. But yes, this is the characteristics of the late majority group, and they do like to test on you knowing what each of these innovation groups function and how they approach new technology. So you want to make sure that you study that as well in your RHIA prep. All right, so with everything that happened, 3rd place, 2nd place, and 1st place. We know who it is. Congratulations, Brenda. Good job, guys. You guys hopefully took something away from this. You learned just how important those details are as you're studying.